Get ready to get another COVID booster shot in a couple months. Canada's National Advisory Committee on Immunization is now recommending another dose ahead of what's expected to be another wave of infections coming this fall. Right now, accessibility to a fourth booster shot varies by province. About 7% of Canadians have had 2 boosters. With us this morning is epidemiologist Raywat Deonandan. Dr. Deonandan, good morning. Welcome back.
Good morning. Thank you very much.
Right now, there are different rules in each province. In Quebec, for example, the fourth shot is available to anyone who's over the age of 18. While in Ontario, they give access to anyone over the age of 60, Indigenous peoples over 18, and people who live in communal living arrangements. In Nova Scotia, New Brunswick, and Saskatchewan, you have to be older than 49 years of age. So who should be getting this fourth dose of the vaccine?
In my opinion, it should be everybody over 18, frankly. There isn't a lot of science to determine these arbitrary age cutoffs. It is, as I said, largely arbitrary, based upon, some hand-waving risk-benefit analyses that are age-specific. But we're looking down the barrel of a 7th wave, and if we care about curtailing that wave, and especially around its transmission, then a 4th dose is relevant for everybody, because a 4th dose not only increases our ability to prevent serious disease, it also restores the vaccine's ability to a large extent to prevent infection and transmission.
You say 7th wave, and I think about all the interviews we've done about a lack of healthcare workers in the system now, when we're not at a peak. There have been arguments that it could be more effective to put more money into medical infrastructure like hospitals and medical staff. In April of this year, there were 125,000 unfilled jobs in our healthcare sector. So what other things in healthcare system need more funding to continue this fight against COVID-19?
We have to do it all, obviously. We have to invest in infrastructure and surveillance, in all the appropriate public health tools. The problem with fixing the healthcare worker crisis is that will take months, years, or even decades. It's not an immediate fix, whereas the 7th wave is coming at us in weeks or months. And so we need to strengthen the immune profile of the population to help buttress that effect, while at the same time investing in improving our healthcare system and our public health prevention methods. And I'd really like to stress the need to focus on public health communication and public science education to help make us immune, no pun intended, against bad ideas and misinformation that's spreading like wildfire through social media.
Yeah, as we look on towards a 7th wave, could we see vaccine mandates put back in place?
I don't think so. I think the public tolerance for that sort of thing is very, very low at the moment. It's a political hot button. No one wants to touch it. It's probably wiser now to just flood the population with tools to protect one another and oneself. We have those tools. We have masks, we have vaccines, we have ventilation tools that haven't been explored fully enough. The engineering community has a lot to say about that. So improving filters in buildings, in your own homes, keeping windows open, etc. That will help enormously. I think the days of mandates are probably over, more for political reasons than for scientific ones, but that's where we are.
Dr. Deonandan, thanks for your time this morning.